Okay, so let's get into it. Let's start to look at the components of this scam. So what do you need really to create this scam? One, you needed to create tremendous fear in the public. And I'm really only going to speak about America and the United States. Other countries followed us, but I'm going to speak about, our laws and legislation that pass, our incentives, our processes here in this country. Everybody else was similar, but let's look at America, okay, first, which is what we always do on this show, okay? So what was the incentive here? The incentive was to scare people. If you're going to scare people and scare the bejesus out of them of dying of the coronavirus, okay, or getting the coronavirus, you're going to be able to do anything you want, okay? So what was the incentive? It was a financial incentive implemented by the legislation of the CARES Act that was passed right at the beginning of the pandemic to incentivize everybody involved in this process to elevate case counts and elevate death counts. So I'm going to show you some documents. I'm going to actually show you a piece of the CARES Act, and I'm going to link to the CARES Act if you're listening on the podcast below the show notes, or if you're watching on YouTube below the video. But it's very important that you look at this legislation and you see this is what was done. This was what the incentive was to cook the books, as an accountant would call it, and make the death counts very high and the case counts very high, because you incentivized the hospitals, the medical facilities, and the doctors and nurses to do this, okay? And how did they do it? They did it with money. So I'm going to take a look at the CARES Act here with you, just one section here. Section 4409, okay? And there's other sections of this, and again, I'm going to link to it. It's 247 pages. They make it voluminous. Nobody reads these things. Not even the people voting on this stuff read it. But you got to look at this stuff if you're really going to analyze this scam. So Section 4409 talks about Medicaid hospital inpatient prospective payment system. Add-on payment for COVID-19 patients during emergency period. Add-on payments. So what happened here was that the hospitals or the health facilities in this country received tremendous extra financial benefit by classifying people as COVID patients, classifying deaths as COVID deaths. So we've all heard the stories, okay, throughout the country of everybody putting COVID down as the cause of death. In hospital after hospital, hundreds of thousands of different hospitals and healthcare centers classifying people as COVID patients, classifying deaths as COVID deaths. Well, why was this? Well, if you look further in the CARES Act, and if you look at the hospital administration and big hospitals in this country, they were allowed to classify COVID deaths 3 days post-mortem, or what post-mortem or after death. Well, what does that mean? That means if somebody comes in, motorcycle accident, gunshot to the head, stabbed in the heart with a knife, and that person, okay, tested positive for up to 3 days after COVID, that hospital or health facility can classify that patient as a COVID case and a COVID death. Okay, so what it did for that hospital or that health facility was gave them a financial incentive up to 20-25% in some cases, tens of thousands of dollars per case if they were able to inflate their COVID numbers and deaths. So in life, and I'm an auditor and trained to look for fraud, if there was an incentive for financial fraud, let me tell you what was going to happen. You were going to find fraud. You were going to find it. And this was anecdotal plus documented cases around the country based on this CARES Act provision that gave people a financial incentive, okay, to classify anything and anything that wasn't nailed down as a COVID death or a COVID case. So the groundwork was laid with the CARES Act under President Trump, to my dismay, to financially fraud the system, okay? And that had tremendous ramifications throughout the whole scamdemic.